of gaining not enough weight in pregnancy have to do with obviously small babies, and more so, these little babies are leeches. They're going to get what they need from you. The risks of not gaining enough are more for your benefit, that it's actually going to affect your health later on, because in order for the baby to get enough nutrients, it's going to steal from your stores. So you do have a small risk of small for gestational age babies, so that's babies that are in the underweight range, but also it affects your health. If you have muscle loss and bone loss if you're not gaining the appropriate weight in pregnancy. Now, on the flip side, gaining too much in pregnancy, you have obviously the other risk, which is babies that are larger, which then has complications of increased risk of C-section, increased risk of larger tears in delivery, of complications for delivery. You also have an increased risk of elevated blood pressure, a condition called preeclampsia that happens when women gain too much weight in pregnancy, and gestational diabetes, which is a diabetes that happens only in pregnancy. But outside of the pregnancy, it's when women have excessive weight gain in pregnancy, it's harder for them later on to take that weight off. So on top of any complications they may have during the pregnancy or with delivery, more excessive weight gain affects the woman later on, because then they are overweight or obese and have to deal with the complications of that, which is obviously high blood pressure and cholesterol and heart disease and increased cancer risks. So it's important to avoid that excessive weight gain in pregnancy, not just for the complications of the pregnancy, but for complications of mom later on. Breastfeeding is the best diet ever. You are getting to still eat for two, and you're using lots of calories to produce that breast milk. But more, I think, again, think about a reasonable plan for yourself. We tell people 9 months up, 9 months down. We don't want you to lose it too quickly. Just coming back to eating that good quality of food. If you have to cut something, we want you to cut your carbohydrates to less than 20% of your diet, and staying active. You now have a baby, get a jogging stroller, go out with that baby and walk, but really an exercise plan will help you with that weight loss.